Although the majority of people who have depression do not commit suicide, having depression does increase suicide risk compared to people without depression. Approximately 60% of people who commit suicide have a mood disorder. Anybody who expresses suicidal thoughts or intentions should be taken very seriously. Before we go any further, let's make this clear. Help is available for you if you or others you know are having suicidal thoughts. You can talk to peer counselors, mental health counselors, and/or healthcare professionals at your school or at your family's healthcare clinic. They will keep your conversations and information confidential. If you are comfortable sharing your thoughts with your parents, family members, or friends, it is advisable to do so. Having the support of medical professionals and the people who love and care about you is very important. Help hotlines are also a great resource. If you are in distress or experiencing a crisis and require an immediate response, call 911 or one of the following help hotlines. The Kristen Brooks Hope Center hotline at 1-800-SUICIDE. The U.S. National Suicide Prevention Lifeline at 1-800-273-TALK. Or the Deaf, Hard of Hearing hotline at 1-800-799-4889. Or try texting the Crisis Text line at 741-741. If you are simply looking to have an anonymous and confidential conversation with an unbiased listener, the Kristen Brooks Hope Center hotline and the Crisis Text line can also help you cope with a range of depressive feelings. For help locating a therapist, healthcare, or basic necessities such as housing and food, call the United Way helpline at 1-800-233-4357. They will direct you to local services. Recognizing the warning signs of suicide is the best way to prevent or minimize the risk for suicide. The signs should be taken seriously and responded to appropriately. They include extreme mood swings, a change in personality, such as from upbeat to quiet, loss of interest in activities that had been previously considered enjoyable, comments about hopelessness, helplessness, worthlessness, and having no purpose, withdrawing from family and friends or voicing feelings of isolation, acting anxious, agitated, or in unbearable pain, putting affairs in order, or preparing for death by giving away personal items and writing a will or farewell notes, and being preoccupied with death in conversation, writing, or drawing, reckless behavior that could result in death, talking about being a burden to others, and talking about wanting to end one's life. If you suspect that someone you know is considering suicide, don't wait to intervene. It's an emergency. Call 911 or a help hotline. The National Institute of Health recommends these 5 action steps for helping someone in emotional pain. Number 1. Ask the question, are you thinking about killing yourself? Number 2. Keep them safe. Reduce a suicidal person's access to places and items that are dangerous or lethal. Number 3. Be there. Listen carefully and acknowledge what the person is thinking and feeling. Number 4. Help them connect. Help them connect to a trusted individual like a family member, friend, spiritual advisor, or mental health professional, and to a help hotline. Number 5, stay connected.